will be the H Pylori paper by Fahd al-Sahibani et al. At King Faisal Specialist Hospital and Research Center, and will be presented by Mustafa Fidekial, Assistant Consultant, King Faisal Specialist Hospital and Research Center.
I'm honored to present this research paper from King Faisal Specialist Hospital, Riyadh, on behalf of this team. This is about treatment of Helicobacter pylori, a randomized control trial comparing standard triple therapy versus sequential therapy. The organism H. pylori is very smart. It is considered 50% of the global population is affected by this organism, and it is a etiological factor for gastric ulcer, duodenal ulcer, multiple lymphoma, chronic gastritis, and it is also considered a causative factor for adenocarcinoma of the stomach. There are a few studies from Saudi Arabia which says the prevalence of infection is between 35 to 78%, and there was one study from Jeddah area which studied the efficacy of triple therapy and found it is effective in 75 to 79% of the cases. We started this study 2 years ago. Then there were a lot of studies from Italy saying high efficacy of sequential therapy for the treatment of H. pylori, and even a meta-analysis suggested almost 93% eradication rate with sequential therapy. Then there are no studies from this area to see the sequential therapy is effective for our patients than standard triple therapy. Then we planned this study with objective of finding whether standard triple therapy is more effective or sequential therapy for eradication, to find the sensitivity of the commonly used test for H. pylori, such as clot test, biopsy and culture in our patients, and to find antibiotic sensitivity pattern in H. pylori. We initially thought of doing a lot of antibiotics, finally ended up in doing ampicillin, metronidazole, clarithromycin and tetracycline. The design, it's a prospective randomized hospital-based study. The project was approved by our Department of Medicine and the research committee. We calculated the power to test this hypothesis and found 115 patients were required in each arm. We collected informed consent from each patient, and a random table was generated by computer. These were the tests we used to confirm the infection. We collected tissues for urea blood test, clot test, histology and culture. Around 5 tissues were taken from different parts of the stomach. Then they were randomized, and if they found infected on any of these tests, they were randomized and given either of this treatment. Triple therapy was given as esomeprazole 20 milligram, clarithromycin 500 milligram, and amoxicillin 1 gram, each given twice daily for 14 days. And the sequential therapy, first, this is a 10 days treatment. From day 1 to day 10, esomeprazole was given 20 milligram twice daily. First 5 days, amoxicillin was given 1 gram twice daily. And on 6th day onwards, clarithromycin 500 milligram and tinidazole 500 milligram given twice daily for a total of 5 days. We confirmed the eradication by doing a urea blood test after 6 weeks completion of treatment, and the patients were off PPI and off antibiotic. We excluded patients who were previously treated for H. pylori and sick patients. During the recruitment started in 2011 November, and by this time, still studies ongoing. By this time, we were able to consent 444 patients, and they underwent endoscopy and tests for this infection. And out of this, 294 patients were not infected. Then the 140 were found positive. Out of that, 93% of them were positive on histology, 78.4% positive on clot test, and 42% on culture. We randomized. So far, 81 patients went into sequential treatment arm and 67 into triple therapy. The baseline characteristics of positive patients, 148. Male were 46%, female 54. The mean age of the population 47.8 with standard deviation of 15.6. The common indication, most common indication was epigastric pain, 48%, then nausea, vomiting, hematemesis, and melena to a lesser extent. These were the most common endoscopic findings from our study. The gastritis in 67.6%, the endoscopy was normal in 15, duodenitis in 13.5, GERD in 6 point, gastric ulcer in 4.7, and duodenal ulcer 3.4. So far, the 108 patients completed both treatment and they came for eradication test of urea bed test. And out of that, the overall eradication rate was 74 of them cleared of the infection, 68.5, and 31.5 are still infected. Which one is more effective, sequential or triple therapy? This was our the main objective of the study. In the sequential arm, 68.3% eradicated infection, and triple therapy 68.75. And statistical analysis shows 0.96, no difference between these two arms. This is this bar chart again shows same result, 68 and 68.75 equal.
You have 2 minutes.
The other objective of the study was to look for the sensitivity. You know, we only got 62 patients were successfully able to culture, and out of that, this is a very difficult organism to culture, and especially to do the sensitivity. We used E-test method. And metronidazole 38 were able to do, ampicillin 23, clarithromycin 42, and tetracycline only 14 patients. So this was a difficult part of the study. And then this is a resistant pattern. Metronidazole 47% resistant, ampicillin 39%, clarithromycin 26%, and tetracycline no resistance. All the 14 tested were sensitive. Mr. Chairman and delegates, I would like to conclude this paper. In our study, out of the tested patients, 33% of them were infected with H. pylori, and the positivity was mostly from the histology, 93%, then clot test 78%, and culture 42%. The overall eradication rate was not very high, 68%, and both standard triple therapy and sequential therapy were equally effective. The yield of culture and sensitivity was not that high, and whatever we got, 47% of them were resistant to metronidazole, 39% to ampicillin, 26% to clarithromycin. And resistance to tetracycline was 0. Thank you.
Well.